Hello students, in today's lecture we will discuss about the anatomy of femoral artery. So my dear students, whenever you are talking about the blood supply of the thigh and the lower limb, you have to understand that there are three arteries which enters into the lower limb from the three different parts. So what these arteries are? One is your femoral artery, and you know that femoral artery is a major artery which enters into the thigh from the front. Apart from that, you will have two more sources of the blood. One is obturator artery and another is inferior gluteal artery. So dear students, the obturator artery and the inferior gluteal arteries are the branches of internal iliac artery. But when we will see the femoral artery, it is external iliac artery. So when you are reading the blood supply of the lower limb, you have to understand that there are three arteries which enter into the lower limb. One is femoral artery, second is obturator, and third is inferior gluteal. Now when you will see the obturator artery, it enters from the pelvis into the thigh by passing through the obturator canal. While when you will see the inferior gluteal artery, it enters into the gluteal region through the greater sciatic notch. So all of these three arteries anastomose with each other in the area of your hip joint. So whenever you are reading the anastomosis in the hip joint, you will find the contribution of the three arteries which are entering into the lower limb. Clear? So in this video clip, I try to explain you the entry of all these three arteries. Now here you can see that this is your one of the major artery which we know is your external iliac artery. Now this external iliac will continue as a femoral artery which enters into the thigh. Now here you can see that this is your internal iliac artery. Now this internal iliac will give rise to arteries known as obturator artery, and you know that this is your obturator foramen. Now here you will have the obturator canal, and through this you can see this artery is here, and this artery will go on the medial side of the thigh, and on the posterior side you will have the gluteal artery. So this is the important thing to understand, that whenever you are talking about the blood supply of the lower limb, you always keep in mind the three sources of the blood supply. Clear? So here if you will fade this pubic part of the your hip bone, now you can very well appreciate that how this obturator artery is going into your thigh, and this is lying on the medial side of the thigh once it passes through this obturator canal or obturator foramen. Clear? And when you will go on the posterior side of the hip bone, you have the greater sciatic notch. Now through this greater sciatic notch, you are having a major blood vessel which is entering into the thigh is your inferior gluteal artery. So inferior gluteal arteries, obturator arteries and branches of the femoral artery, all the three will contribute here in the anastomosis around the hip joint. Clear? Now when we will talk about basically the femoral artery, the first question comes is that femoral artery starts from. That means what is the beginning point of the femoral artery? So when we will talk about the beginning point of the femoral artery, it is a continuation of the external iliac below the level of inguinal ligament at mid-inguinal point. So my dear student, this is a question of your exam. There are two terms you will have: midpoint of inguinal ligament and another is mid-inguinal point. So mid-inguinal point is actually a midpoint of this whole length. Now this is your anterior superior iliac spine, and you know that anterior superior iliac spine give rise to the lateral attachment of inguinal ligament. Here you will have the pubic tubercle. Now this is the distance between ASIS to the pubic tubercle, but this is the pubic symphysis, and this is the distance from ASIS to pubic symphysis. So mid-inguinal region, midpoint of inguinal region is the distance from here to here. That means we are taking the anterior superior iliac spine and the distance up to pubic symphysis. Now its midpoint is known as midpoint of inguinal region or mid-inguinal point. If you will have the question midpoint of inguinal ligament, then you have to take the distance from ASIS to pubic tubercle, that is known as midpoint of inguinal ligament. So, there are two different points, mid-inguinal point and midpoint of inguinal ligament. So, in today's lecture we are dealing the distance from ASIS to the pubic symphysis, clear, and this is your mid-inguinal point, and in the middle of the mid-inguinal point your external iliac artery continue as a femoral artery. So, what is the course of this femoral artery when you will see in the thigh? So, the course has been divided into the two part. In the front of thigh you will have the femoral triangle, and we know that the apex of the femoral triangle continue with the adductor canal. So, you will see the course in femoral triangle and the course in adductor canal. So, dear students, that is why it is only present in the 2/3 part of the front of thigh. You will not find the femoral artery in the whole length. It is present only in the upper 2/3. Why upper 2/3? Because the artery disappear in the junction of 2/3 and 1/3 by entering into the popliteal fossa posteriorly through adductor hiatus. So, that will come in the coming part of the lecture. So, here we have to understand that when we are talking about the course of the artery in the front of thigh, it is only in the 2/3 part, and the course further divided into the two part, the area in femoral triangle and in adductor canal. So, when the artery runs downward and medially from mid-inguinal point, now see, this point is again and again important for you, that we are talking about the midpoint between anterior superior iliac spine and pubic symphysis. So, from this point we are reaching to the adductor hiatus. Now, what is adductor hiatus? Adductor hiatus is a lower end of adductor canal. So, from this point to this point you will find artery into the front of thigh. After this adductor hiatus, the artery will go in the back part, that means in the popliteal fossa. So, from mid-inguinal point to the adductor hiatus you will find the artery, and then from adductor hiatus it enters into the popliteal fossa, which is behind the knee joint. Now, the upper part of the femoral artery you will find into the femoral triangle, and in the triangle this artery will reach from base to the apex of the triangle, and near the apex this artery ultimately enters into the adductor canal, clear. So, whenever you are having the front of thigh, you know that this is your femoral triangle, and the triangle apex continue with the canal is known as adductor canal. So, in this area this is the mid point, and from here this artery will go till this adductor hiatus. But here the course has been divided into the two part, into the triangle and into the hiatus, clear. So, here we are able to now see this artery. Now, this artery is visible here, and when you will see this artery enters here into the thigh at the junction between the ASIS and pubic symphysis, which is known as mid-inguinal point. Now, this is the course of the artery. Now, why you are able to see the whole artery into the front of thigh? My dear students, because I have removed a muscle which is known as sartorius. So, suppose if you will place the muscle which is known as sartorius here, now once the sartorius will be there, you are not able to see this lower part of the artery. Why? Because adductor canal is a subsartorial canal. So, this part is further covered by the sartorius. So, this will become your femoral triangle, and then this will become your adductor canal, clear. The artery passes through the adductor hiatus to enter into the popliteal fossa, and we know that in the popliteal fossa the artery continues as a popliteal artery. So, sometimes you have this question that this is the femoral artery. So, what is the upward continuation, or you can say it is a continuation of which artery? Here it is common iliac, which is dividing into the external iliac and internal iliac, and this external iliac continue as a femoral artery, while the lower end of the femoral artery continue as a popliteal artery, clear. Now, here if we will try to understand what is adductor hiatus. So my dear students, you have to understand that there is a thick muscle is present is adductor magnus. Now this adductor magnus will go and insert on this posterior border, and this border is known as linea aspera. On the linea aspera, this muscle will have a aponeurotic attachment, and there is a gap is present between the aponeurosis of the muscle and the bone, and these gaps are known as osteoaponeurotic gap. And how many gaps are there? So you will find that there are 5 gaps are present, and these gaps allow the different arteries to enter into the posterior compartment, and the largest gap is known as adductor hiatus. So what is adductor hiatus? Adductor hiatus is a kind of osteoaponeurotic gap. Osteoaponeurotic gap matlab, what is the meaning of osteoaponeurotic gap? It is a gap between the bone and the aponeurosis, and it is a aponeurosis of muscle is adductor magnus, and there are 5 such gaps are present, and the largest gap is known as adductor hiatus, which is the lowest gap. So there are 5 gaps are present, and the 5th gap is the largest one, which allow the femoral artery to enter from front of thigh into the back of your knee. Clear? So now here if you will see the course of the femoral artery, you can see that now the muscle comes in the picture. This is your sartorius. So when you will see the dissection, you will realize that this is your femoral triangle, and the femoral artery is visible in the triangle. Now if you will go and rotate this thigh and see from the medial side, you are able to see the adductor canal. And you know that adductor canal one-sided bounded by the vastus medialis. So this is the vastus medialis. Anteriorly it was covered by the sartorius, which we have removed just now, so that you are able to see the artery inside. Or if you want to see from the front, I have removed this vastus medialis also. So now you can see this part of your femoral artery in the adductor canal. So the whole artery course is divided into the 2 parts. This is your part in the thigh, and up to this point, which is known as adductor hiatus, the artery will enter into the back of the joint to become the popliteal artery. And in this course, you have 2 parts. This up to this part, the artery was present in the femoral triangle, and here you will have a adductor canal. So artery is present in the front of thigh in adductor canal in lower part. Clear? So that's why it is written here that the artery lies in only in 2/3 part of the front of thigh, not in the whole length of thigh. Clear? So now what are the relations when artery is running downward from its passing through the inguinal ligament reaching up to the adductor hiatus? What are the structures come in the contact? So when you will see the anterior relation, you know that when you are doing the dissection, you will first remove the skin. Below the skin you will come to know that there is a superficial fascia. Now when you will remove the superficial fascia, you will have a thick layer of the deep fascia is known as fascia lata. So anterior relations are first skin, superficial fascia and fascia lata. Now there is a one more special feature. You know that the proximal part of the femoral vessels covered by a layer is known as femoral sheath. So here you will find that there is a femoral sheath, and this sheath covers the proximal 3 to 4 centimeter part of the femoral artery as well as femoral vein. So the anterior layer of the femoral sheath covers or come in anterior contact of this artery. So what are the anterior relation? Skin, superficial fascia, fascia lata and anterior wall of femoral sheath. Now when you will go posterior to the artery, you will have the posterior wall of the femoral sheath. Clear? So the posterior structure is posterior wall or posterior layer of femoral sheath. Now apart from that, when artery is going downward, it is come in contact with the muscles. So which muscles come in contact from above downward? So this question has been asked so many times. Name the muscles which come in contact or lies behind the femoral artery in the thigh. So my dear students, here you can see there are 3 muscles if you will see from above downward, this is your pectineus. Here you can see it is arising from the pectin part of your hip bone. So this is your pectineus. Then this is the adductor longus, which is coming from the anterior surface of the pubis and it is going downward. And then there is one more muscle which is upper part, and that part is here where you will have some relation with this muscle, and this is your psoas major. So from above downward, if you will see the muscles which lies behind the femoral artery, so here you will have the psoas major, then you will have this pectineus, and below the pectineus this is your adductor longus. So these are the three muscles which come in posterior relation of femoral artery. So what these are? From above downward, psoas major, pectineus and adductor longus. Clear? Now what are the medial relation of the artery? Now we know that there are three structures present in the thigh. From medial to lateral you will have the vein, then you will have artery, and then you will have the nerve. So nerve lies lateral to the artery. But when we are talking about medial to the artery in upper part, this is related with the femoral vein. Clear? So what is the relation of the artery in upper part? Laterally you will have the femoral nerve which is outside the femoral sheath, and medially it is related with the femoral vein. Clear? But my dear students, this is a very important question for your exam. As you will go down, this relation which is side by side relation, you are able to see that artery is on the lateral side and your vein is on the medial side. But as you will go down, the relation will change. How it will change? Here it is written that femoral vein medial to the femoral artery at base of the femoral triangle, that means in the upper part. But gradually it shifted posterior to the artery towards the apex of the triangle. So here you have to understand that these are the two relations here. Now this is laterally placed artery, this is medial vein on my left side. Clear? So what is happening, as you will go gradually downward, this side by side relation will lost. How it will lost? Gradually what will happen, that the vein goes posterior to the artery. So which is the vein? This is the vein. So as you will go down, the vein will go posteriorly. So in lower part you will have antero-posterior relation, while in upper part you will have side by side relation. So as you will go down, the vein will go behind the artery. So this is important thing to understand, that this has been asked so many times, that what is the change in the relation. So in the lower part of the thigh, artery is anterior to the vein, but in upper part of the thigh, artery is lateral to the vein. Clear? Now here in this diagram you are able to appreciate this relation more comfortably. Now here you can see this is the artery which will come anterior to the vein. So this diagram is showing the course of the artery through the adductor canal, where the relation is antero-posterior, but in the upper part of thigh the relation is side by side. Clear? So when you are reading the relation of the femoral artery and the vein, you have to understand that in the upper part they are side by side, but in the lower part they become antero-posterior, and the artery comes anteriorly and vein will go posterior to the artery. So in adductor canal, what relations you will find? You know that what are the boundaries of adductor canal. So anterolaterally the canal is bounded by vastus medialis, so but obviously the vastus medialis comes in the relation. Posteriorly we know that the adductor canal supported by adductor longus and the adductor magnus. So in the adductor canal, artery is come in contact with the adductor magnus also. Medially we know that it is known as subsartorial canal. Why? Because it is covered by the sartorius, so artery itself come in contact with the sartorius muscle. So in the adductor canal you are having the muscle like vastus medialis on the anterolateral side, then you will have posteriorly adductor longus and the magnus, and medially is the sartorius. While in the front of thigh, posterior relation is of the three muscle, Psoas major, pectineus and adductor longus. Now, in the adductor canal, the femoral artery crossed anteriorly by the saphenous nerve. Now, this is again a question of your exam. Sometimes you will have this image based question where you will have this femoral artery in the center. Now, you will have the question on these two structures, one is posteriorly, one is anteriorly. So, the posterior relation is, I just told you, as you will go downward, the vein will go behind the artery. So, posterior relation is femoral vein. But there is one more structure comes anteriorly in the adductor canal, and that is your saphenous nerve. Clear? And we know that this saphenous nerve is going to supply the medial aspect of your leg. So, this nerve has to go from lateral to medial side, because saphenous nerve is a branch of femoral nerve, and in the upper part we have seen that there are three structures: vein, artery, nerve. So, nerve is arising from the lateral side and it has to supply the medial side of the leg. So, it has to cross from lateral to medial side, but at what point it crosses? Answer: inside the adductor canal. So, in the adductor canal, you can see the saphenous nerve is visible, which is anterior to the artery, but it is not remain inside the adductor canal. It ultimately comes out on the medial side to supply the medial aspect of the leg. Clear? Then femoral vein, I already told you, the femoral vein is upper part having a different relation. It is medial to the artery, but in the lower part the vein goes behind the artery. Now, what are the branches of femoral artery? So, there are three sets of the superficial branches and three sets of the deep branches. These 6 branches are arising in the femoral triangle, and there are some branches which arises in the adductor canal. So, when we are talking about the branches in the femoral triangle, there are 3 superficial branches: superficial external pudendal, superficial epigastric, superficial circumflex iliac. Then there are 3 deep branches: profunda femoris or deep femoris artery, deep external pudendal artery, and you will have muscular branches to supply the muscles of thigh. So, my dear students, when you will see the femoral artery, now this is your femoral artery which is entering into the thigh by passing below the inguinal ligament. Now, in this region below the inguinal ligament, this artery will give total 4 branches. In the upper part, it will give 4 branches. Out of these 4, the 3 are superficial external pudendal, superficial epigastric, superficial circumflex iliac. And there is one more artery which is arising just at this level, is the deep external pudendal. So, in some books you might have this line that just below the inguinal ligament the artery give 4 small branches. What these 4 branches? 3 superficial and 1 deep external pudendal. So, all these 4 branches arises in this part of your femoral triangle. So, let us see first the 3 superficial branches. So, here you can see that this is your femoral artery. Now, from this femoral artery there are 3 branches are arising. So, let us discuss these 3 branches. So, here if you will zoom this front of the thigh, you are able to see one branch. Now, this branch is going lateral side. Now, where it is going laterally? It is going towards the anterior superior iliac spine. So, this is known as superficial circumflex iliac artery. So, this superficial circumflex iliac is going towards the iliac crest. Then you will have this superficial epigastric. It is going in upward direction in the anterior abdominal wall. Then you will have this medial branch. This branch is going medially, and this medial branch is going to supply the skin of your external genitalia and pubic region. So, this is your superficial external pudendal. Now, these all 3 are known as superficial branch, because you can see if you place this fascia lata and you will realize that there is a saphenous opening. You can see all these 3 branches are coming out from the saphenous opening, or you can say that these are superficial to the fascia lata, that is why they are superficial. If anything which is deep to the deep fascia is become deep branch, but these are not deep, these are superficial to the fasciolata. They will come out from this opening. One is going towards the external, this is superficial circumflex iliac going towards the iliac crest, superficial epigastric and superficial external pudendal artery. Clear? So, superficial circumflex iliac, it is going laterally where? Towards your iliac crest, or you can say ASIS. Then second is superficial epigastric. It is going in upward direction, and when it ascend, it will enter into the abdominal wall. Then you will have superficial external pudendal. It is a medial branch, and once it arises from the medially, it will supply the skin of your external genitalia and inguinal region. Now, in this image, I try to explain you the two arteries. One is superficial external pudendal and another is deep external pudendal. So, both are your pudendal arteries, both are external. Now, my dear students, you have to understand that pudendal arteries are of two sets, internal pudendal, external pudendal. External pudendal is again of two, superficial and deep. Now, where you will find this internal pudendal? Internal pudendal artery is present in the pudendal canal, and this internal pudendal supply the deep structures of the perineum, like your urogenital diaphragm, like your deep part of the genitals. But when we are talking about outside blood supply, in your genitalia, you are having again external, superficial and external deep. Now, in this diagram, you are able to see both the arteries. Now, this is one of the artery which is also going medially, and this is another artery, it is also going medially. So, both these arteries are going medially, but this upper one is known as superficial. Now, this is your superficial external pudendal, and this lower one is your deep external pudendal. Now, these names superficial and deep are given in response to your spermatic cord. It is said that the deep external pudendal will pass deep to the spermatic cord and it will supply the posterior part of the scrotum and labia. In case of the male, it is going deep to the spermatic cord, while this superficial external pudendal remains superficial to the spermatic cord and it will supply this area of inguinal region. Clear? So, there are two medial branches which are arising from the femoral artery just below the inguinal ligament. Both medial branches are pudendal, both are external, but one is superficial, one is deep. And how you will define superficial and deep? Superficial remains superficial to the spermatic cord, while deep will go behind or deep to the spermatic cord. But basically, they are mainly responsible to supply different superficial areas and cutaneous blood supply of your pudendal and this genital region. Clear? Now, here you have the another deep artery, that is profunda femoris artery. Now, profunda femoris artery is one of the very important deep branch of femoral artery. Now, here in this diagram you can see that this is the artery. Now, this artery is a deep branch, because when you will place the fasciolata on this side, you can see the artery's shadow is visible. On this side you have removed the fasciolata, so you can see this prominency of the artery. So, the artery is not outside the deep fascia, that is why it is a deep branch. Anything which is outside the deep fascia below the skin is superficial, anything which is deep to the deep fascia is deep branch. So, these branches will come out, that is why they become superficial. This is deep to the deep fascia, that is why it is a deep branch of femoral artery. So, what will happen with the profunda femoris? Now, as I already told you that there are osseo-aponeurotic openings are present between the attachment of your adductor magnus and linea aspera of femur bone. So, on these openings, or you can say on these osseo-aponeurotic areas, what will happen? That this profunda femoris artery will give the branches. These branches are known as perforators, and if you will see on the posterior side of the thigh, you can see that these branches are coming out. So, these osseo-aponeurotic openings allow the terminal branches of profunda femoris, which are known as perforators, to enter into the posterior compartment of thigh. And I told you there are 1, 2, 3, 4, 5 hiatuses are there. The fifth is the largest hiatus, which is only for the femoral artery to continue as a popliteal artery. Remaining upper 4 openings or osteoaponeurotic openings allow the terminal parts of profunda femoris to continue in the posterior part as a perforators. And then there is a longitudinal anastomosis occurs between these perforator to supply the blood in the posterior compartment of thigh. Now, what are the other branches? I told you the branches in the femoral triangle. Now, when the artery enters into the adductor canal, it gives one name branch, and that is known as descending genicular artery. Apart from this named branch, the femoral artery also gives multiple small muscular branches. Those will supply the muscles. Now, this descending genicular artery is the artery which is contributing the blood supply of knee joint, because genicular word means something which is pertaining to joint. So, this artery is going to supply the blood to the joint. Now, in this diagram, you can see that this is the genicular artery. Now, this genicular artery is arising at this point, it is running medially downward, and then ultimately it will anastomose with the other genicular arteries of knee joint. Now, this genicular artery basically highest genicular in origin, because there are 1, 2, 3, 4 and one is on the posterior side. There are 5 genicular. Out of these 5, this genicular is highest in origin. That is why it is also known as highest genicular artery. So, highest genicular artery is a artery which is on the medial side and superior. This is inferior genicular, this is superior genicular on the medial, this is superior inferior on the lateral. So, on the medial side you will have this descending genicular artery, and it is a last branch of the femoral artery in the adductor canal, and it arises in the adductor canal just above the hiatus, and it is known as highest genicular artery, because you can see that genicular means the branches which are supplying the knee joint, and out of all the branches it is having the highest origin, and that is why it is known as highest genicular artery. Now, this highest genicular artery here gives a branch. Now, this branch is known as saphenous artery. This branch is known as saphenous artery. Why saphenous artery? Because this branch will continue with a nerve which is known as saphenous nerve. I just told you that the saphenous nerve, which is a branch of femoral nerve, crosses the femoral artery from lateral to medial side in the adductor canal, and once it will cross the adductor canal, it will come out, and there is a branch of the genicular which is running along with the saphenous nerve for a short distance, and that branch which is running for a short distance along with the saphenous nerve is known as saphenous artery or saphenous branch of descending genicular branch of femoral artery. Clear? Now, what are the clinical importance of femoral artery? The most important clinical aspect is palpation of the femoral artery. So, where will you palpate the femoral artery? The pulsation of femoral artery can be felt at mid-inguinal point, that is the junction of anterior superior iliac spine and pubic symphysis. So, the midpoint of that distance you can feel, and here you press the femoral artery against the head of the femur or against the superior ramus of pubis. Now, what is the difference? The difference is here, you can see that this is the point, that is your distance of ASIS to the pubic symphysis, and it is a midpoint of this mid-inguinal area. Now, at this point, if my leg is externally rotated, now when you will do the external rotation of the femur, what will happen? The head will protrude anteriorly. This head will go anteriorly, and now the artery can be felt very well against the head of femur. So, to palpate the artery against the head of the femur should rotate laterally, and once the head will go laterally, the femur will go laterally, head become prominent and it will come out anteriorly. Otherwise, if your leg is internally rotated or in neutral position, then we use this ramus, and this ramus is the superior ramus of pubis. Second use is compression of the femoral artery. To stop the bleeding from the distal part of the lower limb, femoral artery can be compressed against the head of the femur at this point. Clear? Now there are other multiple clinical use of the femoral artery. Commonly used is that it is used very commonly to assess in various medical procedures. Now this artery is used to assess in a various medical procedures. Now what these procedures are? Like when we want to take arterial blood pressure. Now when you accurately want to know the arterial blood pressure, the cannula will pass through the artery and the pressure will measure. Second is when we want to do the arterial blood sample, and these samples are to take the blood gas analysis. The third importance is that there are some invasive procedures like intra-aortic balloon pump therapy. Now this intra-aortic balloon pump therapy is given in case of the shock. What is shock? The shock is a situation when your heart is not able to pump out the sufficient amount of the blood which body require. So when the output of the heart is decreasing, or you can say the oxygenated blood which is coming out from the left ventricle is decreasing and it is not sufficient for our body, at that time to maintain that we have to insert an intra-aortic balloon pump, and that pump is also put into the heart by passing through the femoral artery. The another thing is coronary angiography and angioplasty, and renal angiography and angioplasty and stenting. Now how they do it? Now this is the pathway. Now this is your femoral artery. Now we make a incision here on the artery through the skin, then we'll pass a catheter. Now this catheter is passing from femoral artery into the external iliac. From external iliac you now enter into the common iliac. From the common iliac you will enter into the abdominal aorta. From the abdominal aorta you will enter into the thoracic aorta. Then you will have ascending aorta, arch of aorta and descending aorta. So in this way your catheter will insert and it will reach up to the heart. Clear? And once you will reach up to the heart, you will find out the ostium or the opening of the coronaries, right and left coronary. Now then you will inject a kind of contrast dye, and this dye will go into these blood vessels. Now this is the right coronary artery. So once you will inject the dye through the catheter which is already has been put inside the aorta by passing through the femoral artery, and when you will take the X-ray it will appear like this. So this is your coronary angiography, and for the angiography how this dye will enter? The dye has been entered by passing through a catheter from femoral artery. Clear? Now suppose if you want to study the renal arteries, from this point you can place the catheter inside the renal artery, and then again you can do the study of renal artery. Or if you want to put a stent into the renal artery, you can do the stenting of renal artery also and stenting of coronary arteries also. Clear? So my dear students, at the end of this session of the femoral artery, you should first have the idea that femoral artery is a continuation of external iliac artery at the distance of the ASIS and pubic symphysis midpoint. Second thing is the femoral artery gives the superficial and deep branches. Femoral artery present in upper 2/3 part of the thigh. Femoral artery continue as a popliteal artery at the level of adductor hiatus, and femoral artery lies side by side with the femoral vein in upper part, but the relation become anteroposteriorly as you will go downward. And the last and most important thing is that clinically the femoral artery is used to canalize in multiple procedures. So this is all for the session. Thank you.